Hi, my name is Greg James and I'm one of the counsellors listed on Counselling Directory. I run a private psychotherapy practice near Bath in Somerset, specialising in the treatment of trauma using talk and somatic therapies. The aim of this video is to explain a little bit about what trauma actually is and what can be done to help those who live with the effects of it. Our bodies are designed to ebb and flow with the stresses and joys of life. Moments of vulnerability are experienced as expansion, allowing ourselves to feel joyful and excited and able to socially engage with others. We also naturally experience contractions throughout the day, feeling tired and needing to rest and to recharge. We're able to feel these things because our nervous system is made for balance. In the case of trauma, this balance is upset either temporarily or long term. We've all heard about the threat responses, fight and flight, but not many people realize that we experience micro-threat responses all the time. When you arrive in a large room full of people that you don't know, there might be a little part of you that wants to turn around and go home. That's actually flight energy. It's small and it's manageable, but there's something about that room or the people in it that are threatening to you. Because it's manageable, the body deals with it, we recover and we return to balance. This is a small example of a completed threat response cycle. The point being that activation of the fight and flight response doesn't mean that you're experiencing a trauma. So let me come back to that in a minute. In the meantime, I want to explain what happens biologically when the survival response kicks in. We share a lot of our physiology with other mammals, and this includes the way in which we respond to threat. When an animal senses danger, so a noise from the tree line or something, you'll notice first that it orients to the threat. It looks around and tries to find out where the threat's coming from. At this point, adrenaline has already been released, the heart rate is up and the muscles are poised to fight or to run. If the noise turns out to be nothing, you'll see a shiver run down its spine. This is the animal's way of getting rid of the energy that it turns out it doesn't need. This is its way of completing the threat response cycle. If the threat is real, it uses the energy in the fight and flight response and the cycle is completed in that way. So if you think closer to home and you take your dog to the vet, you probably notice it shakes itself free of fight or flight energy when it comes out of the vet's rooms. It's the same thing. Humans have the same threat response system as other mammals, except that we have more complex brains and have learned adaptive ways by which we can save ourselves from having to feel the sensations in our bodies following a traumatic experience. Distraction, dissociation, and simply just trying to ignore how we feel are all examples of that. While this seems like an advantage, it can get in the way of completing the natural cycle of activation and rest. As a result, humans frequently get stuck in the loop, unable to release the energy naturally when we've been activated by a threat. The energy or the chemical reactions have to go somewhere, and they're stored in all parts of our bodies. Now, if we come back to trauma, trauma is something that is too much and that comes at us too fast for too long, giving our nervous system no time to respond appropriately. The experience pushes the system beyond where it's able to self-regulate, which is why these cycles are often left incomplete. Unable to integrate this experience, the unresolved trauma often plays out seemingly randomly in our current lives in the form of anxiety, panic attacks, depression, anger, and an array of physical symptoms that we may assume are entirely unrelated to our psychological distress. It's important at this point to know that trauma is not just car crashes, wars, or sexual assault. Physical and emotional abuse, parental rejection or neglect, bereavement, medical procedures, military combat, bullying, racism, and witnessing the trauma of others are just a few in a long list of sources of trauma, because they all have the potential to overwhelm the nervous system. So what's the difference between trauma and PTSD? A traumatic experience does not always result in PTSD, just as an adverse experience is not always experienced by someone as a trauma. Levels of resilience or past experiences, the length of time exposed to the traumatic event, and the way in which the trauma is processed or supported after the experience are all factors in whether or not someone will experience symptoms of PTSD. For people suffering with PTSD, the body is unaware of having survived the trauma and is constantly on alert for similar stimuli and responds as if the event were happening again and again. It's important also to remember that an absence of PTSD doesn't mean that someone has not experienced a trauma. So, what do we do about it? Talking therapies are an enormously effective way of helping people to experience positive change in their lives. What we forget, however, is that the body experiences adverse events too. While the brain certainly responds to trauma, it's the body that actually experiences it. So while it's vitally important to attend to the confusion and pain in our minds, understand what happened and make meaning out of it, it's just as important to do the same thing for the body. Somatic therapies like somatic experiencing work to release the incomplete threat responses by bringing awareness of the sensations experienced in the body during the therapy sessions. A somatic trauma therapist will track your nervous system in real time to make sure that it's not overwhelmed as you go through each session. And this allows the body to start to heal from the traumatic events of the past without reliving them. The therapy is designed to counter the experience of trauma, gently allowing the body to use its natural ability to restore balance in the present, where in the past, during a traumatic experience, this simply wasn't an option. So getting in touch with sensations in your body may feel unusual, but it's surprisingly easy. So try it with me for a few seconds. Just while you're sitting there now, think about the last time that someone did something to you to make you angry or annoyed. Or think about something in the future that you're worried or nervous about. If you concentrate on the body and resist the urge to stay in your head where the memory is playing through your mind, you will start to become aware of a physiological reaction to taking your mind to those places. And this is what we work with. There are many ways to treat trauma, and you will find other counsellors on the directory who do so in a variety of effective ways. If you feel you would benefit from somatic psychotherapy, you can find me on the counselling directory and also at gregjames.co.uk. I'm going to leave you with one quote from Dr. Peter Levine, who is a trauma specialist and founder of Somatic Experiencing for the treatment of trauma. He quite simply says this: trauma does not have to be a life sentence.